Good evening and welcome to the COVID-19 update on Channels Television. I'm Kayode Okikyolu. Here are some of the highlights. Director General of the Nigeria Center for Disease Control, NCDC, says the COVID-19 pandemic remains a national concern as he asks more Nigerians to join in the fight. Find out how students in Anambra and Adamawa State are coping amidst COVID-19 as WAEC examinations continue today. And World Health Organization asks countries to prevent vaccine nationalism, calling for improved global cooperation instead. Thank you for joining us on the program. 16 states and the FCT account for the 417 new cases of COVID-19 in the country as Nigeria inches closer to the 50,000 mark, with 49,485 total confirmed cases of the virus across the country. The good news is that the total number of recoveries are also on the rise, with 337 patients receiving a clean bill of health, bringing Nigeria's total discharges to 36,834, while deaths increased to 977, with 2 new fatalities in the last 24 hours. A breakdown of the latest figures across 16 states and the FCT shows Lagos with 207, Kaduna with 44, Ondo 38, Abia 28, Anambra 21, Plateau 20, Bauchi 13, Oyo and Ebonyi 9 each, Delta and Edo with 7, Enugu 6, Niger 3, Gombe 2, Ogun, FCT and Kano with 1 case each. Well, on a bigger scale, Africa's COVID-19 cases have surpassed the 1.1 million mark, with South Africa accounting for over half of the continent's infections. According to figures from the Africa Center for Disease Control, of the 1.128 million total cases in Africa, 589,886 infections have been reported in South Africa, over 96,000 in Egypt. Nigeria has the third highest cases with over 49,000, while Morocco and Ghana round off the top 5 countries with 43,558 cases and 42,658 cases respectively. Over 846,000 people have recovered, while 25,884 deaths have been recorded. Back here in Nigeria, a team from the NCDC, led by the Director General, Dr. Chikwe Ihekwezu, has been inspecting health facilities in Akwa Ibom as the state combats the COVID-19 virus. The team went round the Emergency Operations Center, isolation wards, laboratories, and other facilities built by the state government to improve healthcare delivery during and after the COVID-19 pandemic. After the tour, Dr. Ihekwezu called for increased collaboration at all levels to stay ahead of the virus.
The challenge to Akwa Ibom is a challenge to Nigeria, but I think it has put health on the political agenda more than ever before, and I think the Honorable Commissioner will agree to that. And our responsibility now as leaders in the health sector is to make sure that we continue persevering, because this is a very tough response. But we know that there will be a better future for all of us out of this. So we use the opportunity of this crisis, make sure we deliver on the crisis, prevent as many cases as possible, diagnose as many as we can and manage them effectively, prevent deaths as much as we can, but critically, build back better for the future. Make sure that we leave our state and our country in a better place to respond to similar outbreaks way after this one. It's a lovely facility, lovely building, but what makes an EOC is the work that happens in it. So I've challenged the colleagues working here to take it as a responsibility to keep this place alive, learn the techniques and working of an EOC, and develop it further. But we look forward to really collaborating, strengthening the already existing strong collaboration between the federal government, the Presidential Task Force, the Nigeria Center for Disease Control, and the good people and government of Akwa Ibom State.
Well, it is day 2 of the senior secondary school certificate examination across the country, and we continue to monitor the conduct and compliance with COVID-19 protocols. A visit to some schools in Anambra State shows the students well placed out, or spaced out rather, in the examination halls, a measure that on the one hand ensures that they maintain social distance and on the other reduces the possibility of examination malpractice. Colonel Mike Atta Secondary School, Ngunando, in Anambra East local government area, is one of the schools in the remote rural area of Anambra State. The sight of these water tanks speaks volumes of both federal and state government provision for the COVID-19 requirements. The students wear their face masks, each sitting according to COVID-19 protocols.
I'm in the college to see that the COVID protocol is observed and our children are quite safe, and I'm elated with the efficiency of the management in handling the situation. And yesterday they had their mathematics exam. Today, chemistry practical is going on, and everything is working out well, and we give God the glory.
Things are quite different at Federal Science and Technical College, Awka, where the COVID-19 preventive protocol is carried out in a stricter manner. From the gate, the temperature check is done, followed by the sanitation process of hand washing. The students taking chemistry practical alternative A are well spaced out in the sitting arrangement.
As you can see, we are taking our WAEC examinations, and the paper we have today is our chemistry practical alternative A. While I was at home, I felt really bad because, frankly speaking, by now we are supposed to be graduates of secondary school. But still, I kept hoping on God that God will sort out the issue.
For the challenge is, we don't really have much because the principal, we really thank her, Mrs. Nia Margaret. She's really doing well in this college. She makes everything. Everything is just provided for us. We have light to study. There's no excuse for the students now. So everything is going. We have water. Nothing is lacking.
The teachers have promised to conduct an examination that the nation will be proud of. But more important to all, particularly health workers, is to have zero infection among students after the examination. Well, let's head over to Adamawa State, where the government has promised to take punitive measures against any school principal who fails to adhere strictly to the COVID-19 protocols during the conduct of the West African Senior Secondary School examinations in the state. The State Commissioner for Education, who went round schools in Yola, the state capital, to ensure compliance, says that government takes protection of the students seriously. Medical Laboratory Services of FCT Primary Healthcare Board, Clementina Anoa. She joins us via Skype this evening to discuss Nigeria's measures, especially in the area of testing. Well, good evening and thank you for joining us on the program. You know, for a while now, we've been trying to... You're welcome. For a while now, we've been trying to get to the root of Nigeria's testing problem. It's been quite challenging from day one of this pandemic. And I'd like to know, from your angle, have you been able to, place your finger on where that challenge is really?
In my view, where the challenging lies is basically on advocacy. Because our people, it takes time for them to understand. So there is the need to educate them at the community level, at the church level, at the mosque level, at the offices, and other social grounds where they usually interact. There is the need to let them know about COVID-19, for them to know the services available, for them to also be aware that it's not a death sentence, that when you get tested, you get encouraged. You also know the services available, and people need to know that even when the person is positive, there is what we call asymptomatic and symptomatic cases. And currently, some can even have self-isolation at home and be monitored from the Public Health Services Department. So even at the market, people need to know about COVID-19 sample collection. At the social gatherings, in different areas, there need to increase advocacy so that people will avail themselves of the opportunities available for them, especially now government is funding COVID-19 testing and treatment. So the challenge we actually have in our system is people, out of fear, don't avail themselves of the opportunity to get tested. And with that, the transmission is at the community level and almost virtual aspect of our lives. So I feel that there's the need for more advocacy so that people will make use of the testing centers, the sample collection centers, come out, stop hiding, stop pretending, and stop dying in silence.
You know, particularly now, I recall the DG of the NCDC saying that a lot of people are not confident to come forward for testing. He says there's a capacity actually, but people are not confident. And, you know, speaking to some people, they feel that the testing might be compromised. Now, this is what you will hear on the street. So if you can just walk us through that process, how tamper-proof is a testing for COVID-19 so people can indeed know that, wait a minute, it's not compromised?
Okay, actually, what the federal government has in place, and that is what we advocated, and that's why I said during advocacy, people need to get this information. There's what we call enrollment number. When you are enrolled for the test, you have what you call a PID number. That a PID number is a unique number. It is with that number you track your results, and there is no way you get the APID number except from the SOMAS app we are using, which is controlled by NCDC. And when the result is also released, the result gets to the individual personally with that APID number. It is also with the APID number you trace the result. It is also with the APID number you can do a retest. So it is not actually compromised. I think what is the problem is that people don't have information. These rumor mongers give a lot of false impression of what is happening. And there are also accredited centers for sample collection, which we need to be verified. Government is providing free services for that. And there is no way it can be compromised when it is free. And with that IP number, even some private facilities that are also testing, they also don't have their own number. They also get this number from NCDC. So the fact that it is being controlled using an app, so there is only one number controlled by NCDC, Nigerian Center for Disease Control. And it is only that number that you'll be able to use to get enrolled in testing and in treatment.
Okay, just one more thing. I know you've been involved with laboratory accreditation for standard and training. And, you know, we'll be talking about getting tests closer to the people. Why can't primary healthcare centers conduct tests in Nigeria?
Okay, thank you for that. I work in primary health center. It's a gradual process. Recently, specifically last week, Friday, I work in FCT. We pulled personnel from primary health care centers in FCT. Here in FCT, we have 6 area councils, and we drafted personnel from most of our primary health centers as a start. We were able to train them on sample collection. We also train them on case investigation. We train them on contact tracing. The next step we have now by Thursday is to call the heads of those facilities for a startup. And by next week, we'll go on an assessment. With that, we want to have a testing at the doorsteps of most of our communities here in FCT, which I also want other states to employ that idea, which is very good. So for now, in FCT, we want to increase our sample collection centers. The same with private organization. In that training, we included some private health facilities as a part of the trainers, so that we'll be able to expand sample collection centers here in FCT. And with that, people will not have any excuse of having to go far away to get the test done. In the last time that I was here, I said currently in FCT, we have over 15 sample collection centers, and we have over 7 testing centers. So with that, I think we are really trying to decentralize services in FCT.
Okay, so we'd like to thank you.
Can within a short distance, go
Right.
for sample collection.
Okay, and we wish you the very best in that. But I'd like to thank you so much, the Deputy Director and Head of Medical Laboratory Services at the FCT Primary Healthcare Board, Clementina Noai. Thank you for your time.
Okay, thank you so much for having me.
You're welcome. Well, the WHO is asking countries not to hoard the COVID-19 vaccine, and WHO is also proposing a way out. We'll tell you about that when we return. Please stay with us. You're welcome back to the COVID-19 update. Well, let's head over to Benue State, where Governor Samuel Ortom is appealing to the federal government to consider the extension of the COVID-19 Special Public Works Program targeted at unemployed Nigerians to support them in ameliorating the impact of the lockdown. Governor Ortom made this appeal while receiving the Benue State Steering Committee of the program at the Government House to discuss collaboration with state agencies for the recruitment and placement of the beneficiaries. That's once the program takes off in October.
We all need each other to be able to surmount the challenges that are facing us. It's beyond, Mr. President, it's beyond me. It's beyond every leader in Nigeria today. And so my appeal to Nigerians is that we come together and leave sentiment, ethnicity, partisanship, emotions, sentiments. Let's leave them behind and fight for the common good. We have no other country other than Nigeria. And no one from America, from Europe, from Asia, we come here in Nigeria to help us make things right. It is our responsibility.
Dr. Ogonaya Iguelo is a public health physician. She joins us via Skype this evening. Good evening. Thank you for joining us. I know you were involved with the Ebola outbreak in 2014. In fact, you got some recognition and you were part of the EOC at that time. But it's a different ballgame now with COVID-19. And I'd like to begin by asking, what has been the most difficult hill for you to climb in this journey?
I think it's definitely the amount of, the cases and definitely the mortality. Now, the thing about the difference between this virus and then the Ebola virus was that with the Ebola virus, once you're sick, you can barely move around. You're already ill, you're already down. But now the thing about the COVID-19 is that even while you're healthy, you're healthy, you're still carrying the virus and you're not even aware that you have the virus. And that subtle ability has to just, cause mortality, especially in individuals who are vulnerable. It's really shocking. And the effect it has on the body, with something one has never really seen before. So that's definitely what was really something different. That was why it was really a different experience for me. And of course, the numbers were more.
Clearly, I mean, and it appears as though, of course, we're not done with this battle yet. But I recall the PTF yesterday talking about fatigue. Now, the committee mentioned that fatigue is a major issue. I mean, 6 months into this battle, and they identified fatigue as a major challenge, fatigue for health workers, even for journalists, and I can tell you about that. But really, what is a way out, really? How do we reinvigorate in this fight such that we don't get tired and drop the ball?
So that's the thing. The fatigue eventually, of course, was definitely going to come. Why? Because this is a virus that has been here for a long time, and it's been predicted that it will be here for probably many more months. And remember that this virus, it's not visible, and the way it works is that it can infect people even without them being aware that they're even ill. And of course, you're seeing the rise in mortality. So what happens is that because we know that the virus doesn't have a timeline, people move the virus. So it depends on what measures are we putting in place. That is how we can be able to curb this virus. So I think the issue is just keep engaging the community, keep encouraging ourselves. But remember that those numbers that we see, that are being, brought out by the NCDC. Those are people's, grandmothers. Those are people's mothers, fathers. Those are people's children that have died, or that there were cases. So, the thing is that eventually, like, even till today, we're still having people come down with this illness, and we're still having more deaths. So when you think about it, that is what, at least that should be a driver that this is something that is still killing people. People are still losing loved ones. So I know that, yes, it's definitely, the fatigue is there. And not just even physically, even with our resources. Because remember that a number of our resources are also being stopped. So definitely it's going to come, it's going to happen. But when at the end of the day, when we see that, we are saving lives, if in whatever thing we're doing, even if it's in public health, in journalism, the laboratory scientists, whatever, when we think about the number of lives we are saving each day, we do it, and of course the community as well, the Nigerian community, when they put on their masks. By putting on your mask, you're preventing that, that vulnerable person from dying. When you think about these things, it should be a form of, driver, or even encouragement, even if nothing else, that we're carrying, we're taking this social responsibility and saying, no, enough of these deaths. We don't want people coming down with this anymore. We will just keep moving on and keep encouraging ourselves and keep doing what we can till we fight this and this is over.
I feel reinvigorated already. But thank you so much, Dr. Ogunaya Aguilo, public health physician. Thank you for your thoughts on the program.
Thank you for having me. Thank you.
Well, I said outside the country, the WHO, that's World Health Organization, is proposing a phased vaccine allocation process to reduce inequality in vaccine procurement, especially for countries with lower economic power. The head of the WHO, Dr. Tedros Ghebreyesus, at a virtual meeting earlier today, asked countries to prevent vaccine nationalism by working together, and especially multilaterally, to ensure that everyone gets a chance at the vaccine.
The World Health Organization also says it is concerned that the novel coronavirus spread is being driven by people, young people, that is, people in their 20s, 30s, and 40s, many of whom are unaware they have been infected, posing a danger to vulnerable groups.
This increases the risk of spillovers to the most vulnerable, the elderly, the sick, people in long-term care, people who live in densely populated urban areas, and underserved rural areas. We must redouble effort to stop the virus from moving into vulnerable communities.
Here's a look at the situation in other parts of the world. In Germany, Chancellor Angela Merkel has called on Germans to stick to the coronavirus rules, such as wearing masks, to ensure public life can be as open as possible. She warned, however, that a recent rise in coronavirus cases had been caused by greater mobility and more personal contact, and that she did not think now was the time to ease restrictions any further.
Protect people from the threat of coronavirus.
The UK's Health Secretary Matt Hancock says England will scrap the government agency responsible for responding to public health emergencies after the country has suffered the highest death rate in England from the coronavirus pandemic. Public Health England, a cornerstone of the state-run health system with responsibility for managing infectious disease outbreaks, will have many of its functions with the government's contact tracing service into a new body to be known as the National Institute for Health Protection. Finally, in the United States, some schools are once again turning to online learning as the number of COVID-19 cases in the country reached more than 5.4 million. As the pandemic situation is growing, more die in the country, some reopened schools were forced to switch back to online learning following campus COVID-19 clusters.
Well, I'm checking our websites, channelstv.com, and you should too, where you can get access to all the updates you need across different areas: business, politics, sports, of course, COVID-19, all at your fingertips. Once again, channelstv.com is a place to go. Well, that's the program for this evening. Thank you so much for watching. I'm Kayode Okikiolu. Do stay safe.